Hey everyone, my name is Dr. Dolores Tarver. I'm a licensed psychologist here in Georgia, and it is time for the TT Time with Dr. Tarver is a wellness-based podcast. It is not intended to be a substitute for a relationship with a licensed mental health provider. Here we are, back in April, rolling along with this second week. As I shared last week, April is in honor of a lot of different things, including Black Maternal Health Week, Minority Health Month, Stress Awareness Month, Alcohol Awareness, Autism Acceptance, Counseling Awareness, and Sexual Assault Awareness and Prevention. So today I'm going to focus on Black Maternal Health Week, which is recognized April 11th through 17th. So I think it's fitting that this episode focus on the mental health of pregnant and postpartum African American women. So let's get into it. A lot of stats. I want to kind of start off with the organization Black Mamas Matter Alliance, and they really focus on trying to bring awareness to Black maternal health issues, provide some education, but also be able to provide support for women who may be experiencing a variety of different things before, during, and after their pregnancy. So I did want to highlight that in the weeks leading up until delivery and following delivery, that a lot of African American women experience a mood disorder, and that can affect up to about 1 in 7 women in the United States. Black women not only face a higher chance of developing mood disorders right after birth or right before birth as compared to white counterparts, but they also are less likely to receive treatment. And there's a lot of different reasons for that. You all know there's a lot of stigma around seeking treatment, particularly for mental health, but also that we don't want people to say, like, oh, you're not a good mother, you can't take care of your children. And then someone does a call in to a child welfare service. And then also, I think just financial barriers when you are pregnant. That can be a very stressful time because you may not be able to work because, as we know, the risk factors for African American women are higher, and so there may be some issues that women are dealing with that doesn't allow them to be able to work during that time because they need to be resting to reduce those risk factors. And so for a lot of people, financially, as they're thinking about their options, they may not really feel like therapy is an option for them. And often, if you are on state plans like a Medicaid, sometimes there are challenges being able to see providers, and particularly getting a chance to see providers based on the fact that they accept your insurance or don't accept your insurance, and that could really limit who you're able to see. Black women reported higher symptoms of mental health problems, however, were diagnosed less often. So even though we are reporting symptoms, we're not getting those diagnoses, which I think speaks to sometimes that bias that may occur in the dismissal of when African American and women express that they're having symptoms, that it is chalked up to, oh, you're just under some stress, you'll be okay, or that we're whining and complaining. And so what we're expressing is minimized. 10% of pregnant women and 13% of women who just gave birth experienced some type of mental health disorder. And it primarily is depression, but I'm going to talk about depression, anxiety, and psychosis that can be postpartum. About 600,000 women will develop depression each year related to a live birth, and the total numbers are likely far higher than that because if we consider the other mental health disorders, not just the depression, we recognize that we'll see a spike in those cases. Mental health problems can range from depression to substance use to trauma, and oftentimes they're unidentified in many cases as a contributing factor in pregnancy related deaths. And so, unfortunately, risk factors can be really high for African American women just due to a lack of social support, particularly for our younger mothers who are teens or young adults, and family members may have cut you off, are not going to support you, got pregnant. Moms who are unwed often talk about feeling very isolated and not having a support system. And if you are in a conflictual relationship with your co parent, that can also end up isolating you, and you have that lack of social support. So when we're disconnected and we may not, again, we're not able to work, so we don't have that connection at work. We possibly may have been told by an employer that we cannot work, and so that leads to us having more financial challenges. Low socioeconomic status, of course, is going to be a risk factor. General stress can be a risk factor. We've got the poor access to health care, and again, that is dictated largely by a person's insurance, their ability to have transportation or be able to do video appointments. Do you have the resources to be able to have a stable connection? Sometimes people are in rural areas, their internet is not real great, or if I'm cutting costs, maybe I don't have the capacity to afford to have that internet because maybe I am not necessarily able to keep up with a phone bill. If there is a prior history of a depression, a family history of depression, a history of an eating disorder, that increases risk factors. Difficulty being able to get pregnant, having multiples, twins, triplets, on up, being preterm, so having a baby before 37 weeks is a risk factor. A history of an infant who experienced SID, so that's that sudden infant death syndrome, or birth complications such as a miscarriage, a stillbirth, umbilical cord wrapped around the child's neck, hemorrhaging. A lot of different things can happen, unfortunately, during that birthing process. Any type of history of sexual or physical violence, lack of access to good education or learning disorder, or other factors that could influence comprehension and understanding. We know that trauma can also manifest during the birthing process because when there is not that connection or that history, then a provider may not know a person has experienced sexual and physical abuse. So they're not asking for permission to touch a person, not getting consent before touching them during that process of labor and delivery. And also, there could be subtle language. We talk about microaggressions, but that subtle language that providers may use, they may say something that may come off across as judgmental. They may make assumptions, or they may not ask questions, and they may not get information. And so these are also things that can pose risk factors. So, what are some of the symptoms when we talk about mental health of our mothers? So, we know that postpartum depression is probably the one that people hear the most about. And postpartum depression looks very similar to a major depressive disorder. So you're going to have that depressed mood, mood swings. You may be crying uncontrollably. It may just be a disconnect with your baby and you don't feel like you're bonding. It's almost as if they feel like an alien to you, which was, what does that do? Causes us guilt because we feel like, okay, I'm a terrible mother. I'm not even bonding with my child. It may be that you feel withdrawn. You don't feel connected to your family. You don't feel connected to your co-parent, to your friends. Maybe you're not eating as much as you used to, or you're eating more than you used to. You may not have the capacity to be able to sleep really well because you can't get to sleep or you can't stay asleep, or you may be experiencing hypersomnia where you're sleeping much of the day. You can be really tired, feel very fatigued, not enjoy things in the way that you used to. And then, of course, we've talked about the cognitive distortions that can come along with depression. I'm not a good mother. It's not going to get better. This child deserves better than me. I'm feeling worthless. Then again, I feel ashamed because I'm having these thoughts. I feel inadequate. Then I feel guilty because this child deserves better. They deserve better than to have me as a mom, and I'm going to ruin them, and they're going to end up having all of these psychological issues because I'm an inadequate parent. And then I think of course, when you have all of those thoughts going on, it makes it really difficult to be able to think really clearly, which means that it can be very difficult to make decisions. Things may feel very overwhelming to you, and you may struggle with just your attention and your focus. You may find that you're having processing issues when people are talking to you. You might feel like you're zoned out. Postpartum anxiety has very similar symptoms to an anxiety disorder and can include panic attacks. For some people, it can be very severe anxiety. You may be ruminating about hurting yourself or hurting your baby. The thoughts may feel very intrusive. It may be recurrent thoughts of death or suicide. You may feel very confused. And in this anxiety, it can lead to psychosis as well, where now I'm hallucinating and I'm having delusions. I'm getting to a point where I'm paranoid. Maybe I feel like I have these bursts of energy. My thoughts are racing really fast. Maybe in the anxiety or psychosis state, because we're working ourselves up, we might experience the heart palpitations, the hyperventilating, the sweating, which is again consistent with a panic attack. You may find that your GI system is really off and there's nausea and there's vomiting. There may be shakiness or trembling. You may be very scared to hold your baby. You may have fears of dropping your baby or harming your baby in some other kind of way. Maybe I'll give them something they're allergic to, or maybe the bath water will be too hot. Or maybe they'll be allergic to this lotion that I'm putting on. Maybe I'm not changing their diaper correctly. Um, I'm not going to know what to do. They're crying. I can't get them to stop crying. I'm not going to be able to figure this out. So, there's a lot of different things that women can experience. And particularly if you haven't had a lot of sleep, that it exacerbates it. Or if your baby might be colicky, or maybe they've had a lot of ongoing health issues since they've come out of the hospital, as we talked about the risk factors earlier. All of these things can really play into what you're feeling, and if you're not getting help and support. So, those moms who are trying to take care of a lot of things on your own, you're trying to heal in your own body. You may have had to get a cesarean, or perhaps you had some tearing and you had to get stitches, and so you're trying to heal your own wounds, but then you can't do that because you're trying to take care of this baby. And it can get to be really overwhelming to women, and they're struggling. They don't have a lot of people that they can go to for help, or they have people but they're not helping them, or they're making them feel bad about it, guilty about it. And again, if I'm in a relationship where I'm having a lot of conflict, then of course this can be feeding into all of these areas as well. So, what do we do? The National Institute of Health has a lot of good recommendations, and I think being able to address trauma that women may experience across the course of their lives is very important. So that's in prior to getting pregnant. It could be childhood, early adulthood. It could be during the pregnancy and in the postpartum phase. But we do want to ask those questions about what types of things people have experienced, because we want to make sure that we have a clear understanding of all of the factors that may be affecting them, because again, there's a lot of risk factors. So we want to do our due diligence in understanding if our moms are at risk for any of those things. We're always going to want to ask for consent to touch. We don't need to assume, and if you have ever been pregnant or know somebody that was pregnant, like, women can be very protective of just people randomly touching them, particularly when they have a child they're carrying for a lot of different reasons. And we want to be sensitive to that and not just assume that it's okay for us not only just to touch your person, but particularly to touch your womb, right? So, asking questions about what a mother is experiencing. Talk to her and not at her. And this goes for providers, but also for family members. Really understanding and supporting the mothers in your life to make sure that they actually are being able to be open and honest with you, because you are asking them questions and getting an understanding without being judgmental, without attacking them, dismissing what they're experiencing. And oftentimes women will say they tried to express that they were very concerned about some of the thoughts that they were having and what they were experiencing, and people were dismissive of what they were expressing. Oh, you'll be fine. All mothers feel like that. Don't worry about it. You just need some rest. And not really asking those more detailed questions about what that woman means when she says, I'm not feeling connected to my baby. Something doesn't feel right with me. I feel different. I can't quite explain it. Right. And so if you don't understand, like, okay, well, let me take you somewhere, because let's just make sure that you're not experiencing any postpartum symptoms of mental health. We want women to feel dignified and respected, that they're in a humane space and they're receiving empathic care. That's very important for you to be able to go into a space that honors your body autonomy, because we don't want people to be mistreated because there's discrimination or bias. We're making assumptions, and all of us have to be honest that we have a bias. Your bias may be toward mothers who are not married. Your bias may be toward couples who are the same gender. Your bias may be toward particular ethnic groups. And so being able to understand if a person has maybe what you perceive to be lack of education and understanding. And so you can be very demeaning to people, even if you may not necessarily be intentionally trying to do that. How you're coming across can be very off putting to people. So we want to make sure that we're actively listening, that we're answering questions. Moms may have a lot of questions, and you don't ever want to put a mother in a position where she feels like she can't ask questions because she thinks her questions are unintelligent or you're not going to fully answer her questions. And those are some of the ways to just dismantle power dynamics that can exist, whether that's in a mental health provider role or a physical health provider role or as a family member, friend, or partner. We want to create these spaces that foster ability for us to have some critical dialogue. You may have a recommendation. Maybe you read something, you saw something. It may not feel comfortable to me. Maybe that's not the way I was raised. I have concerns about that. And so I'm going to ask you some questions. Maybe I'm going to ask for some research and not getting defensive when people don't necessarily take your recommendations, because that's oftentimes what we'll do is, well, I'm not going to talk to you about anything because I'm telling you to do stuff and you're not doing it. Instead of understanding that a person has options and you want to give them information, but it's up to them what they do for that information with that information. For providers, you want to be responsive when you have people email you and call you. They don't need to be waiting 2, 3, 4, 5, 6 weeks or not receive a message at all from you about what they contacted you about. And it's also important for us to be advocates in a variety of ways, right? To help people with access, talking to them about insurance, talking to them about their benefits, what resources may be available if they don't have insurance that will cover their needs, if there are specialized tests that may benefit them, being able to identify their support system. If they don't have a support system, what kinds of things may we be able to put in place to help them have some support. Having spaces that feel inviting so that I see myself on your magazines, that I see books that relate to and connect with my experience, that the pamphlets are things that I may be concerned about, that I may have questions about, that the pictures are reflective of a variety of experiences as a mom. And so that it's not the stereotypical, I only see pictures of people who are married and who are a heterosexual couple, because that may not be my experience, and I don't want to be in a place where I feel like, oh, okay, well, I can't be seen here because I don't look like this. I don't present in this way. And so we want to make sure that in a variety of reading levels, things with pictures and not as much font, right? So that we can be able to think about how do we empower people in this space and they don't feel like they're already in a struggle when they come in. And this team approach is very important. So knowing that you're working collaboratively with the mom, and it's not that you are a tyrant over her, but also considering individual experiences, because every person's individual experiences can affect their mental health along with systems of oppression. There may be cultural dynamics. There are historical contexts that are really important for us to understand. Things that they may not even be aware may be influencing them, influencing their pregnancy, influencing how they're perceiving parenting and their ability to be able to be an effective parent. And I do think it's very important for us that we understand that some of our clients are going to value speaking with someone who looks like them, who they feel like they can relate to, who has a shared or similar experience. Even if it's not the same experience, there is this understanding of, you know, what this struggle could be like, and not to take that personal. And I think a lot of times as providers, we can get really defensive when people have preferences for who they want to see if it's not us. But being able to understand what's most important is that you are matched with the person that is the best fit for you and that you get the care that you need. And which is why it's very important that all of us providers are trained to be culturally competent, but also that our mental health professionals are working with our medical providers. And so we are creating systems of care that are more comprehensive, that are more collaborative, and that also allow that client to be able to feel supported in a variety of areas. Because you may see some things that may cause some concern regarding this person's mental health. You may say, hey, there are a lot of different options for you addressing these. That could be exercise and mindfulness and relaxation. That could be medication. It also could be mental health. You know, I was going to get that plug in there where you get some therapy. It could be a support system of other mothers. It could be where we're going to increase your rest. It could be talking about things such as, hey, cuddling can really help with your baby, can really help with reducing the anxiety hormone that you may be feeling, right? And being able to get support with breastfeeding. That was one of the things that was tough for me as a first time mom, only time mom, is the breastfeeding and this latching on. And it's not comfortable. Nobody told me it was going to be this painful. And do I want to keep doing this, right? And so all of these questions, doulas and a birthing plan and a postpartum plan and help with sleep training and potty training and tips to soothe and comfort your baby. Maybe they're colicky. Maybe they're having some GI issues. How do I know what's going on with them? Maybe they're having some ear infections and some drainage issues. Being able to get help at home. Being able to have balance of being able to be a person outside of being a mom. So all of these things are really important. And I think that for all mothers being able to understand all the possible things. I know a lot of times we're like, oh, don't speak that over people. You don't want to bring up stuff that may not happen. But I do think it's important in this education piece to understand what could happen so you know the signs and symptoms. If there are things going on with your body that you need to report to your provider, that's important for you to know what to look out for. It's also important for you to know if you're not getting what you need from your provider, that you can seek another provider who is going to listen to you and work with you. It's important for you to know that you may need mental health resources. And here's what postpartum anxiety, depression, and psychosis can look like. So that when you start experiencing them, you know what it is, and then you know, hey, this is who I can reach out to. Here are my options. So already having preventatively those things in place can be very helpful. Understanding that babies can have allergic reactions to certain things. Understanding the breastfeeding process and what if my milk doesn't come in and I don't produce enough milk, right? And again, the how I beat myself up, like I'm not a good mom, I can't produce enough to even feed my child. And the guilt that some moms experience because they cannot breastfeed, their milk doesn't come in, and then how to address that, and understanding that hey, I can order breast milk. There are places where I can get that support. So these things are really important because again, I will tell you probably most every week, prevention is always better than intervention. I'd rather you have the resources so that when you need them, you don't have to go looking for them. You don't have to question what's going on. You'll have an understanding and you can have a plan. Then you not have the information and not have the resources, and then you're in a situation where you could have received help and support and didn't know it was available. So let me leave you with this. Sis, you're not alone. Take good care of yourself before, during, and after your pregnancy. We've got your back. Be well.